Okay, Dr. Patterson here. And in this video, I'm going to be addressing the issue of personalized fasting. Fasting is something that's as old as the hills. Patients have been doing that, or people have been doing that according to religion, um, culture, that sort of thing. But here we do what is called personalized fasting, uh, quite different from some of the fasting methods that you probably learn online. And the reason being is that patients come in and we view each patient as an individual, simply because they're individuals and they have different conditions. Uh, and I've seen this. We've taken a family of four siblings, and they all have basically the same diagnosis: obesity, diabetes, but they respond quite differently to the therapy plan. So I'm going to be addressing the fast through. Now, this is a book that I wrote. I put together for our patients who fast. It's called the Fasting Directive. I put this together about, let me see, 2011. Okay, it's very simple reading, very easy. It's designed for a fourth grader and up to read. That's just how simple it is. So, in putting this together, it's a couple things that you as a patient, quite older, need to know about fasting. I put in here that the purpose is to, for us in terms of living, is to live and maintain strength. So that's in the first part of the book. And there's information about how to do that. And the funny part about it is that 70% of the public and Americans, they suffer with chronic illnesses, and it's all self-inflicted. It's rare that something is a disease, and that's 70 percentile or 70%. It's something that's coming from the outside. Okay, so it's something that they're doing. It's basically nutrition related. And we look at autoimmune disease. It was noticed that not until 1960 did Africa see lupus. There was no trace of Africa in the entire continent of Africa. And you had researchers looking all over, looking for different diseases that was pertinent to Africans. They didn't have lupus until they came in contact with Westerners who started bringing the Western diet over there. So we know that African Americans didn't have lupus until maybe about the mid to late 1800s. It started to show up. So what was the difference? The people come from the same, we're descendants from the continent of Africa, okay, came here in late 1500s, 1600s, those of us that came here that route, and developed lupus after about 150 to 200 years of being here. How did that happen? A change in diet, change in topography, a different location. So you can really put this on the inability to adapt to a new type of substance masquerading itself as food. And it got progressively worse. So by the 1970s, we had full-blown cases to be what is called, we're listed as a sub culture or race of people amongst all of the in terms of the diversity of races. That's what we're listed as. We have the highest level of lupus of all groups. So we cannot adapt to the type of food that was forced upon us, then the type of food that we started to consume later as it became more processed. Food's been processed for about 200 years now. So the more processed it is, the more reactions, reactions and food allergies that we have. It's across the board. It's not just African Americans, but we, for some reason, cannot adapt to that. Just like we don't adapt well to dairy. And there are a lot of diseases that are associated with dairy consumption, even though the dairy market and the dairy producers say that milk is necessary. It might be necessary if you're more Nordic, okay? They did not adjust or lose the enzyme to digest milk and dairy and milk products. We did. So it's not part of our culture. It's not part of our genetics. And the military are the ones that found it out, but we just do not digest the uh, dairy after being weaned. Now, the other thing is that once you realize this, then what do you do? So that's what the purpose of fasting is. So what we do is we try to get the patient to understand that we're not punishing them. A lot of them think that they're being punished. And we're trying to um, detox a lot of accumulated waste matter that's built up in the body. And it comes via by way of the colon. Okay, so basically, all autoimmune diseases stem from dysfunctional colon, where you have leakage of these um, undigested food proteins that get back into the bloodstream and they're recycled. And then what happens is that you develop allergies to that because the body looks at that as a foreign substance and produces antibodies to it. So it seems like your own antibodies are attacking the body. They're attacking these foreign proteins. So we've got to get that stuff out. And so the best way to deal with that is through fasting. It could be what we would call a prolonged fast is 27 to 30 days, maybe 40 days. We've had a patient go 40 days on the fast who did very well. So now, why is the fast so important in terms of being personalized? Because most fasts, you learn to just stop eating after a certain period of time. I'm just going to drink water. You can go 3 days max on a dry fast. I wouldn't recommend that because of the strain on the kidneys, especially African Americans. We have problems with our kidneys, and this is something that developed over the last 400 years. And some of it is, there are many contributing factors, stress being one of the top ones, inability to release water like we should. We have so many antiperspirants. The areas where you should sweat and release has been made to seem unattractive. Shaving of the hair and the armpits and pubic areas and whatnot. These are things that cosmetics have really done to destroy the functioning or limit or inhibit the natural functioning of the human body. So we get into that. But the thing that we do is we want to find out through testing what supplements that the patient, herbal supplements that the patient will need during fasting. Now, these are not normally utilized or used when you're talking about just a general fast. We want to get the patient into ketosis. So we have to, and that's where the body is using fat for energy. Once it does that, then you'll start to, what you consider to be weight loss is really waist loss and the utilization of fat. So it appears that you're losing weight, and you are losing some weight. The other thing is that we want to prepare the body for the fast. I don't recommend that you go right into a water fast without, 5 to 7 days preparation. What I mean by preparation, we've got to reduce the amount of waste that's already present in the colon, because once you stop eating, then some of this waste matter it's going to leak into the bloodstream. So headaches, nauseousness, blurred vision, coated tongue, dizziness, these are things that are associated with the waste matter not being diluted with food once you stop or discontinue consuming food. So there are a couple things. So this is why we got to prepare for it, because you want to reduce those symptoms. And the only way you can reduce those symptoms is through a personalized preparation, herbal preparation, that we find out what it is that's causing harm to your body, all the organs, lungs, liver, heart, kidneys, gallbladders, stomach. These are things that we need to know, this information. Then it's also supported by your labs. We want to find out your C-reactive protein levels, your cholesterol levels, triglyceride levels, your liver enzyme levels. These are things that help us to determine what it is that your body is deficient of, or maybe you are in excess in terms of the organs functioning, over functioning. and then we want to bring that into what is called homeostasis. So there's a couple things that you're going to need. You're going to need this. This is an enema kit, okay, because you will be taking enemas at home on a daily basis after you complete the 5-day or 7-day fast preparation. Okay, there's no food with the fast preparation, but you will be consuming herbal teas and juices to put your body at ease. It helps to break the appetite. The most important thing is eliminating stored waste that's in the colon. It's going to flush the kidneys a lot. So you will be urinating quite a bit, defecating quite a bit, and you'll see that you will not really have an appetite for food. You will have mental images tempting you, but you don't need that. Another thing that you need is this. Some people need this. Now, this is a pediatric, what we call a blue bulb syringe, and we use that for children, but we found that there were some adults who we were able to administer the colonic, but due to their anatomy, they had problems. If it's not done by an experienced person, practitioner, they had problems with the administration of the colon therapy procedure. But then they also had problems taking enemas at home. So they had to use which they had to use this quite often during a session. They had to use a blue bulb syringe or a pediatric syringe in order for them to be able to administer colonic. The other thing that you would need would be the ketone strips, okay? These strips here will tell you when you're in ketosis. They look like this. You just dip this in urine. It's color coded, okay? So you can see. Hope you can see that. It's color coded. You dip that in urine. It's going to give you some kind of color, lets you know where you are in terms of ketosis, okay? Ketosis is you're well into the fast when you get to. I'm just looking at this here, this color chart here. It'll appear this color here, sort of a magenta color. You're well into ketosis then. Okay, usually you're not in ketosis when you're on the 5-day fast preparation until you get to about day 7, 5, 6, or 7. Most of our patients do 5 days. And then once they get into the water portion of the fast, and this is water only, we have several ways of doing it. That second day, you're into ketosis. If you use lemon, honey, and water, which is the way I was taught by the late Dr. Alvenia Fulton, and we use that more than we do the water-only portion, which we use just distilled water at that time when the patient is using water only. They will use the lemon, honey, and water because even though it only gives you about 400 or less calories per day, you still will lose about a pound a day in terms of weight, but your body will go into ketosis about the 3rd day. When you use water only, that 1st or 2nd day, you're in strict ketosis. So I put together something. I'm just going to go through some of our literature because the patients needed something to follow, give them an understanding. As I said before, you're going to see a reduction. If you have elevated blood pressure, you're going to see a reduction in the blood pressure. You will balance your cholesterol, your triglycerides, or fat in the blood. The triglycerides is an indication when they're elevated. You're eating things like chips, a lot of cookies, ice cream, things of that nature. You'll see elevation in your triglycerides. We look at that. C-reactive protein gives us an indication of the amount of inflammation in the body. Same way with homocysteine, your glucose, your hemoglobin A1C levels. And that's basically when we talk about we're trying to get that glucose, insulin down, glucose levels down. That the 5-day fast preparation helps with that. And so you don't have symptoms, but you also are looking at moving more toward utilizing your body fat for the energy that it needs. The brain can operate on ketosis. Ketosis is not something that you want to be in constantly just for a short period of time. It's more of a protective mechanism for the body. And that's the way people generally ate that live closer to nature. We live close to machines, and that's where the processing of foods come in. Um, we have a situation where we have responses to that also. So that's your chronic illnesses, and so that's one of the side effects of the fortified and enriched foods, where they have to, during the processing of foods, you may lose a certain level of nutrients. They have to put those nutrients back, or the food itself doesn't contain the nutrients, so they have to put nutrients in. That's the fortification of food. People react to that, see. And so what I've noticed, not just from a um, personal perspective, in terms of treating a patient personally, I've noticed that African Americans respond quite differently to different supplements than Caucasians do. Now, Caucasians can take in synthetics much better than we can and not have a reaction. African Americans can take synthetics. This could be drugs. This could be, what was that? This could be uh, supplements, herbals, and what have you. Uh, they can take this in for 90 days before it becomes toxic in the body. Oops, let me put this over here. It's gonna pop. And so that's the difference. So there are racial differences based on the amount of melanin that's in the body, based on body habitus, based on where your genetics is basically from. So the more equatorial you are in terms of origin, or as far as your genealogy, you should be more of a plant-based eater. Okay, now there's some that were found to eat meat in the equatorial regions, and then, however, the more Nordic you are, you can tolerate more meats, you can tolerate more synthetics, and not have adverse reactions for a longer period of time. You will have them, but not the way the African Americans do. So basically, we're looking to reduce the hemoglobin A1C, reduce the weight. We correct the posture. Any type of postural distortions are corrected with the 4 adjustments prior to starting the program. Some patients respond to or have issues with their kidneys, and we can adjust for that with the livers. There's certain herbs that will get these little birds here on my window here. There's certain herbs that will help to support the kidneys. Same way with the lungs. You get this excess mucus that is expelled through the lungs during this period of time. As long as you don't have infection or fractures, we can work with you in terms of fast. And then once you complete the 5-day fast, you start with a colonic. First, you do your 5 to 7 day food 5-day cleanse, and then you've had your 4 adjustments. Then you start with your enemas. Okay, so the enema is daily enemas is very important. You won't get as much out in terms of waste matter as you will with the colonic, but you will relieve yourself of waste matter that's very toxic to the body after we've cleaned out so much during those 5 days. That's very important. The other issue is we want to make sure that we eliminate the residue of foreign substances from drugs. Okay, they're toxic metals that can get into the body from the air, things that you come in contact with through cooking, like aluminum. So some of the side effects that you experience is from heavy metals, from then also parasites, certain bacterias. These can all be eliminated. We have to incorporate it. We have to incorporate sauna. The sauna helps to relieve the body of heavy metals. You sweat this stuff out. So it's a combination. It's not just the fasting via water. and elimination of food. It's a combination of things that the body must do in order to reach optimal success with a fast. So the incorporation of the sauna, sweating. I don't recommend a lot of exercise. We want you to rest. You'll notice it because once you sweat out the heavy metals to where it's minimal in the body, you relieve yourself of this excess sugar that's in the bloodstream, excess salt. There are other things, chemicals from, for instance, if you dry clean your clothes, there's certain chemicals in the dry cleaning fluid that's in the body tissue, the body fat. Once that comes out, you'll notice that you'll sleep better and then you'll have a lot of energy. The other thing is that you have more time. And I put in a post, I believe, on Instagram where you actually gain about 5 hours of time. You no longer have to worry about thinking about food, although people do, but the contemplation of food, the acquisition, preparation of food, the consumption and digestion of food, that consumes about 5 hours of time. You have much more time when you're going through a fast. You're much more productive when you're going through a fast. And then the other benefit is the economics of it. You're not going to the store purchasing food frivolously, okay? If you do water only, you don't have to worry about the lemon and the honey, okay? So these are things that the body is doing to bring itself into what is called homeostasis. And so once you complete that, once you've completed, you're on a regimen where you're getting colonics twice a week or at least once a week, you're taking daily enemas except for days that you receive the colonics, and you get to a point where the body, when you get to the last week, there's very little waste matter coming out. At least that's the way it should be. Is you don't expel much mucus through the lungs anymore. You should get to a point where the underarm aroma is not there anymore. The body doesn't have this negative aroma anymore. That's gone. You'll see that your hair and your nails will start to grow if you have trouble with that. So there are many positives in terms of physiology that we can see. Okay, there's many positive with economics that we can see. A lot of positive with time that you see. And then once you break the fast, you don't go right into eating a meal. You have to break the fast by bringing up the hydrochloric acid in the stomach, your parietal cells. You want to stimulate that to secrete HCl. When you do that, you'll be able to digest your food. It takes about a day to 2 days to do that, and then you're able to consume food again. Once you consume the food, it should be very light. It should be a water-based. This is for everyone. It should be more of a plant-based, water-based, and a small amount to give your body a chance to assimilate this food. It'll call for the amount of food that it wants through hunger. So this will be real hunger. The hunger that you receive in terms of impulses is not hunger. These are certain types of cravings because of the amount of waste matter that you have in your cells, and the bacteria that's good in the colon has not received its natural, normal amount of natural foods to assimilate. So then that's what's starving right now. So that's what you're feeling. You're feeling the effects of bacteria that doesn't have enough nutrients, not enough probiotics and prebiotics, and the side effects of the processed foods that you basically overdosed on. Okay, it's the stuff that's masquerading as food. It has chemicals in it. So that's the process. And so when you reintroduce food back, that's the best time for your body to eliminate any possibility of old habits where you're on a diet of, sugars and grease and pork and things of that nature. Some people can eat pork. Pork should be medicinal in terms of use, but it should not be for human consumption in terms of keeping the body alive on a daily basis, unless that's the only thing that you have. Okay, and it should be consumed a very small amount, if at all. So that's my take on fasting. Remember, like I said, um, I recommend this for our patients who are fasting. It's easy reading. They will also get, or we recommend they get the colon therapy, but because so many people have negative opinions about colon therapy, and I can understand that from a perspective. During Black History Month, I'll talk about the reason why, especially Black men and women, are so resistant to having this procedure done. Okay, so there is some validity to it, uh, and you need to know about it. Something we'll discuss during Black History Month. So that's my talk on fasting. And we're talking about personalized fasting rather than just a general fast. You need to be examined, tested, and once you get that done, then you'll find out that you will have greater success with the fast. Okay, best in health.